Aspirants of European Diploma in Intensive Care. Here I am Dr. Sunil Garg to guide you in the journey. In this video, we will go through several questions spanning different organ systems. I will read the questions for you. If you still need more time to understand questions, you can pause the video to read question yourself. You can take your own time to practice and understand. Subsequent to the question, you will find the correct answer for that question and its explanation. For questions number 11, there will not be any answer and explanation available. This is a new feature of my video and this question is designed in a different manner and unique way. You can write its answer and explanation in the comment section box to have a wonderful discussion. For any more explanation, please write down in the comment section so I can respond there. I wish you a great journey ahead. The primary aim of initiating this is to introduce you to a variety of questions the way it appears in exam with different organ system. Questions are based on basic knowledge and concepts and easy to understand and their difficulty level is moderate. These questions are designed to test knowledge and understanding of critical care. The explanation provides the rationale behind the correct answer, helping to reinforce learning and understanding of key concepts in critical care medicine. Now you can see questions and their choices. Question number 1. A 45-year-old woman is admitted to ICU with acute respiratory distress syndrome secondary to sepsis. She is mechanically ventilated with the following settings: tidal volume 6 ml per kg, predicted body weight, PEEP 10 cm of water, FiO2 0.6, and a respiratory rate of 30 per minute. Her end inspiratory alveolar pressure is 26 cm of water. Arterial blood gas shows pH 7.32, PaCO2 60 mm of mercury, PaO2 70 mm of mercury, bicarbonate 27 milliequivalent per liter. Patient is given broad spectrum antibiotics and she is hemodynamically stable without any support. What is the most appropriate next step in her ventilatory management? Option A. Increase tidal volume to reduce CO2 but to keep plateau pressure less than 30 cm of water. Option B. Increase respiratory rate to reduce CO2 to a level below 50 mm of mercury. Option C. Increase PEEP to improve oxygenation. Option D. Increase FiO2 to keep PaO2 more than 80 mm of mercury. And option E. She does not require any change in ventilatory parameters. The correct answer is option E. She does not require any change in ventilatory parameters. Explanation. Question 2. A 46-year-old male presented with 2 days history of cough and fever. He was given oxygen through non-rebreathing mask in view of hypoxia and started on broad-spectrum antibiotic. Chest X-ray confirmed the diagnosis of pneumonia. Expectorant sent for pneumonia panel and culture. Pneumonia panel was positive for Staphylococcus aureus 10 raised to 7 and MAC-A gene. Antibiotics de-escalated. After 48 hours, his expectorant culture turned out positive for the same organism, and additionally he grew the same organism in blood culture. Based on this information, which of the following antibiotic is not a right choice for this patient? Option A, vancomycin. Option B, daptomycin. Option C, linezolid. Option D, ceftaroline. And option E, ceftobiprole. Correct answer is option B, daptomycin. Question 3. A 23-year-old male presented to hospital after road accident in unconscious state. On arrival, his vitals were stable except sinus tachycardia. Neurological examination includes unresponsive patient with GCS7 and normal pupil. Which of the following is appropriate management to begin with? Option A, mask ventilation, midazolam, direct laryngoscopy, endotracheal intubation with cervical collar. Option B, mask ventilation, etomidate, fiber optic intubation with manual inline stabilization. Option C, intubation is not required and only cervical collar should be placed. Option D, rapid sequence intubation under direct laryngoscopy with propofol and succinylcholine and manual inline stabilization, cervical collar. And option E, rapid sequence intubation with succinylcholine and cervical collar in place. The correct answer is option D, rapid sequence intubation under direct laryngoscopy with propofol and succinylcholine and manual inline stabilization and cervical collar. Question 4. A 62-year-old man presents with feeling dizzy and breathless. He has a history of ischemic heart disease. On examination, he looks pale and clammy. His heart rate is 36 per minute, blood pressure 76 by 48 mm of mercury, and ECG shows a Mobist type 2 AV block. He was given atropine to a maximum of 3 mg, but the blood pressure and heart rate remain same, and now he is mildly confused. Which of the following would be the most appropriate management? Option A, adrenaline. Option B, dopamine. Option C, transvenous spacing. Option D, transcutaneous spacing. And option E, isoprenaline. The correct answer is option C, transvenous spacing. Question number 5. A 52-year-old man presented to hospital with 3 days history of fever, cough and expectoration. On presentation, he was hypoxic and hypotensive. Initial chest X-ray was consistent with pneumonia. He was started on intravenous antibiotics after culture sample collection in addition to oxygen, intravenous fluids and vasopressor. Regarding sample collection, which of the following is most appropriate? Option A, bronchoalveolar lavage. Option B, expectorated sputum. Option C, blood. Option D, blood and expectorated sputum. And option E, blood and bronchoalveolar lavage. The correct answer is option D, blood and expectorated sputum. Question 6. Difficult to treat resistance Pseudomonas aeruginosa. Which of the following antibiotic is not effective against it? Option A, amikacin. Option B, cefidrochol. Option C, ceftolozane tazobactam. Option D, ceftazidime avibactam. And option E, meropenem vaporbactam. Correct answer is option E, meropenem vaporbactam. Question number 7. A 22-year-old female, 17 weeks pregnant, presented with 1 week history of worsening breathlessness and EG fatigability. It was her first pregnancy and her past medical history was not relevant. On examination, she was tachycardic, tachypneic, dyspneic, edematous and pale. Her vital parameters were heart rate 102 per minute regular, respiratory rate 26 per minute, blood pressure 160 by 90 mm of mercury, and on cardiopulmonary auscultation there were bilateral minimal basal cracks and pansystolic murmur was audible over whole pericardium. Lab investigations revealed hemoglobin 8.2 gram per deciliter, white blood cell count 4600, platelet count 81,000, serum creatinine 106 micromole per liter, serum albumin 16 gram per liter, normal liver function and urine protein 4 plus and blood 1 plus. What is the most likely diagnosis for this patient? Option A, preeclampsia. Option B, HELP syndrome. Option C, nephrotic syndrome. Option D, systemic lupus erythematosus. And option E, glomerulonephritis. The correct answer is option D, systemic lupus erythematosus. Question number 8. A CRRT was planned on a 36-year-old male. A case of septic shock with multi-organ dysfunction. Dialysis catheter was placed on him. Which of the following option is best regarding choice of a catheter insertion site for renal replacement therapy? Option A, femoral vein as first option and internal jugular as second. Option B, internal jugular vein as first option and femoral vein as second. Option C, right internal jugular vein as first option and left internal jugular vein as second. Option D, right internal jugular vein as first option and femoral vein as second. And option E, right internal jugular vein as first option and subclavian vein as second. Correct answer is option D, right internal jugular vein as first option and femoral vein as second. Question number 9. An 81-year-old female presented with worsening headache and confusion over last few days. Her vital parameters are stable. She is drowsy with normal pupils, no focal deficit, no neck rigidity. Her past medical history is significant of heart failure, chronic hyponatremia, and osteoarthritis, for which she is on furosemide, diclofenac, and tolvaptan. Her GCS is 13 by 15. Lab investigations revealed hemoglobin 11.2 gram percent, normal white cell count, serum sodium 1 for 1 milliequivalent per liter, potassium 4.7 milliequivalent per liter, urea 17 millimole per liter, and serum creatinine 282 micromole per liter. Her liver function, blood sugar, and arterial blood gas is normal. Her brain imaging was planned to evaluate further. What do you expect in her brain imaging as most likely cause of altered neurological status? Option A, osmotic demyelination. Option B, ischemic stroke. Option C, meningitis. Option D, subarachnoid hemorrhage. And option E, venous sinus thrombosis. Correct answer is option A, osmotic demyelination. Question 10. A 32-year-old type 1 diabetic patient presented to emergency department with vomiting and in dehydration. He has been having a cough and fever for last 3 days. On presentation, he was tachycardic, febrile and hypotensive. He was continuously taking his prescribed long and short acting insulin. On arterial blood gas analysis, he was acidotic. His urine ketone was 4 plus positive and blood sugar was 30 millimole per liter. He was started on insulin infusion and IV fluid along with antibiotics. Which of the following statement is true regarding his management? Option A, he must be given 10 unit insulin per hour. Option B, his long-acting insulin must be continued. Option C, his target blood glucose level is 6 to 10 millimole. Option D, if acidosis is present, sodium bicarbonate should be given. And option E, potassium supplementation should be initiated along with insulin. Correct answer is option B, his long-acting insulin must be continued. Thanks for watching this video. If you have any feedback, suggestions or comments, please write down in the comment section. Once again, thanks for watching this video. See you in next video on some interesting topics and questions. Till then, bye and take care.